Hi, this is Dr. Melanie Palm from Artist Skin MD in Solana Beach, California, and we already did part one of hand rejuvenation, which was actually adding a little bit of volume to the back of the hand where we have a tendency to lose volume there. The tendons become a little bit more visible, and so do the veins. So we did a little bit of a half syringe of radius, which is calcium hydroxyapatite. Now we're going to actually rejuvenate the outside of the skin. So as you can see on this patient, there's some sunspots that are here, and this is an excellent way to get rid of them is the intense pulse light or an IPL treatment. The machine that we have is called an M22. It's biluminous. We'll show you a photo of that right now. This is a fabulous machine. We use it to treat brown spots, broken capillaries, rosacea. We even use it in photodynamic therapy when we're trying to get rid of precancerous spots as well as significant photo damage. It works great on hands, and since hands kind of tell the story of our lives, this is a great, quick and easy way to treat it. It's going to be painless. We had topical numbing on the patient for about 40 minutes. You'll see this is a quick and easy procedure. Right now I'm actually going to put on some clear gel. This acts as a barrier. It feels good for the patient because we've cooled it. And it also protects the very top layer of the skin, which is called our epidermis. The IPL is going to focus, I've sort of changed the setting, so it's going to focus just on brown pigmentation. So you can see a lot of these brown spots. We're even going to get this patient's knuckles. These little brown spots after treatment are going to turn darker. They're going to look like coffee grounds. And on the hands, it takes about 2 weeks for them to sort of come off. But after we've removed that, it's going to look like just one even pretty coloration of skin tone, which is really one of the things that we on a subconscious level see as youthful skin. Procter & Gamble actually did a study about 10 years ago and looked at patients and different degrees of pigmentation, and having a clear, even tone to your skin can decrease the age of your skin by about 10 to 20 years. So we're going to try and do that right now, and I bet a bit more since we've actually rejuvenated the volume too. So with that, we're going to get started. So we're going to have some cool air going at the same time, again, to protect the patient and also keep her more comfortable. This is the intense pulse light treatment. So we're going to get started. You're going to see a big flash bulb. 1, 2, 3. And as you can see, the patient's comfortable. I sometimes tell patients on the back of the hands, sometimes it's a little more uncomfortable. We just don't have a lot of soft tissue coverage. And so, especially when going over veins, sometimes it's a little bit more uncomfortable. Blowing this cool air, so we use sort of forced air cooling, I think really helps keep the patient comfortable. And as you can see, this is really quick and easy. This M22 Biluminous is a fantastic IPL. It's quick, it's very reliable. It has a large treatment window, so the size of this crystal, so I'm actually able to treat skin pretty darn quickly, which patients often appreciate too, because that means less time in the chair treating them. So you can see at this point we've actually treated the whole back of the hand. I'll actually finish up with this. We are going to catch these little brown guys and be complete with this, but as you can see already, some of the brown spots are already turning a little darker, and they'll flake off in about 2 weeks' time. So that's the end of our part 2 session, doing IPL to rejuvenate the hands to remove some of the brown spots. Thanks so much for tuning in.